What if I told you that your feet might be sending you secret messages about the health of your liver? It sounds a little out there, I know, but there's a really fascinating connection. So let's dive in and learn how to decode these signals our body is sending us, starting from the ground up.
So, really, what are your feet trying to tell you? We're about to unpack a whole bunch of clues, from weird spots on your skin all the way to your toenails, that could actually point back to how your liver is doing.
Okay, but before we go any further, let's get one really important thing straight. Think of this as a guide to understanding potential clues, not a diagnosis. Seriously, if any of this stuff sounds familiar, your one and only next step should be to talk to your doctor. They're the only ones who can give you real medical advice.
So, why the feet? I mean, of all places, right? Well, think about it like this. Your heart has a tough job. It has to pump blood all the way down to your toes and then pull it all the way back up. It's literally the furthest point from the central command. So if there's a system-wide issue like poor circulation, that's often one of the very first places you're going to see the signs. All right, let's start with the stuff you can actually see. The clues right there on the skin of their lower legs and feet. These are the visual warning signs that something deeper inside might be a little off.
So, clue number one, you might notice these little red and brown dots, kind of like tiny specks on your lower legs. These pop up because of poor circulation and little leaky blood vessels. This can be a major hint that you might have low platelets, a condition that's often tied to a liver that's not working at 100%.
And that condition has a big, fancy name, thrombocytopenia. But let's just break it down real quick. Thrombo refers to clotting, cyto means cell, and penia just means low. So it's literally just a low count of your clotting cells. And when you don't have enough of them, tiny blood vessels can leak, and boom, that's where you get the DATs.
Next up, spider veins. You know those little web-like networks of red blood vessels? Well, their appearance can be tied directly to one of the liver's most important jobs, being a hormone manager. See, a healthy liver helps get rid of excess estrogen. But if it's struggling, estrogen levels can build up, causing those little blood vessels to expand and become way more visible. Now, this next clue is a perfect example of another one of the liver's jobs. You know those super stubborn, cracked heels that no amount of lotion seems to fix? It might not just be dry skin. It can actually be a sign of a vitamin B3 or an omega-3 deficiency. And you might ask, why? Because your liver is what produces the bile you need to absorb those nutrients in the first place. If the bile flow is weak, your absorption is weak, and your skin is one of the first places to show it.
And speaking of bile, what happens if it gets totally backed up? Well, you can get crazy itchy feet, especially on the bottoms. This is a classic sign of a congested liver. When that bile can't get out, it literally backs up into your bloodstream. Then these little things called bile salts get deposited in your skin, and that's what triggers that absolutely maddening itch. Okay, so the clues aren't just things you can see. Let's move past what's on the surface and talk about what you might actually feel. Here we've got a whole grab bag of sensory clues. First, foot pain that you just can't explain. It can feel exactly like plantar fasciitis, but it might actually be what's called referred pain, coming all the way from a stressed out liver. Second, foot odor that just won't quit. When the liver can't filter toxins properly, your body has to push them out somewhere else, like through the sweat on your feet. And finally, temperature. Hot feet are a pretty common sign of an overworked liver. But, and this is wild, so are cold feet. That's because your liver does about 80% of the work converting your inactive thyroid hormone T4 into the active form T3, which basically runs your body's thermostat. A sluggish liver can mean a colder you.
And two more big ones, swelling and fungus. Ever press on your shin or ankle and the little dent stays there for a second? That's called pitting edema. It can happen when the liver isn't making enough of a key protein called albumin, which is supposed to keep fluid inside your blood vessels. And toenail fungus? Well, your liver is a massive hub for your immune system. If the liver is compromised, your body's defenses are down, and that gives things like fungus a perfect opportunity to move in and take over.
So, we've looked at all these different clues: red dots, itchy feet, fungus, all of it. Now, let's connect all the dots and finally unmask the prime suspect behind every single one of them.
And here it is. This is where it all comes together. Your liver is the master control center for all of this stuff. It handles detox, which stops that bad odor. It regulates your hormones, which prevents spider veins. It makes the bile you need for healthy skin, stopping those cracked heels. It creates the proteins that prevent swelling, and it's a command center for your immune system, which fights off fungus. See?
Every single clue leads right back to one of the liver's main jobs.
But listen, here is the most incredible, most hopeful part of this whole story. Your liver has a superpower. It is one of the only organs in your entire body that can almost completely regenerate itself. This means this isn't a story about permanent damage. It's a story about amazing potential. You actually have the power to help it heal. So, how in the world do you do that? Let's get right into a simple, actionable plan you can use to support your liver and help it do its amazing regenerative thing. It really all starts with what you eat, and the approach is pretty straightforward. On one side, you have the stuff to avoid, the things that just totally overload the liver, like too much alcohol, tons of sugar, and all that processed junk food. And on the other side, you have your liver's best friends, things like cruciferous vegetables that help its detox pathways, and intermittent fasting, which gives your entire system, liver included, a much-needed break to rest and repair. And if you want some extra targeted support, there are a few key supplements to know about. Milk thistle is famous for basically acting like a bodyguard for your liver cells. Tudka is a really special type of bile salt that helps thin out the bile and, well, helps everything drain properly. And cod liver oil is just fantastic because it gives you those omega-3s and vitamins A and D that you need to lower inflammation and rebuild healthy skin from the inside out. So we've seen how everything from an itchy foot to a cracked heel can be a message. Our bodies are talking to us constantly. The only real question left is, are you ready to start listening?